tobacco cessation. Physicians have done a lot for tobacco control in recent years, but only 50 years ago we were advertising in JAMA and other medical journals about how good cigarettes were. So we had to be careful about knowing it all. Tobacco kills more people worldwide than HIV, TB, and malaria combined. So it's anywhere between 5 to 6 million people die directly related to tobacco. In the US, as of last year, 13.7% of the adults smoke, which is much lower than what it used to be. It still translates to around 35 million adults. There's nearly 500,000 deaths which are directly related to tobacco. And the healthcare cost related to tobacco is about $170 billion. So it's a big issue. So this is the trend in cigarette smoking in adults and high. Sorry, I'm on service and call. Let me move this. Trends in cigarette smoking in adults and students over the last more than 40 years in adults. As you can see, for the adults, it was more than 40%. It has come down to closer to just below 20%. The students, from the 80s, it went up a little bit, and then it's been coming down. So till about 2011, so this has been a good trend. A lot of work had gone into this from public health, and there's been a significant decrease in tobacco use. But, so this is from tobacco product use among U.S. high school students in the last 10 years, between 2011 and 2019. As you can see, cigarette use, continues to trend down, slowly, and is around somewhere around 5%. But electronic cigarette use in the last few years has increased tremendously, right? This is about more than 25%. This is what they call as current use, which means they have used a product within the last 30 days. So that's more than 25% of high school students said they had smoked an electronic cigarette within the last 30 days last year. This is a big concerning issue. This is the same data for 2019, looked at it differently. So the tobacco product use overall is little more than 30% for high school students. And majority of them, a vast majority of them, was electronic cigarettes. And the rest of them is regular cigarette smoking is 5 or 6%, and hookah smoking is around 3.5%. You may all know about some of these names, specifically Juul. There's several others. There's Blue and a bunch of others. As you can see, Juul is the one very, very popular among kids, electronic cigarette. It looks like a USB drive, and it's easy to hide and take it anywhere they want. And essentially, it's a leader in the market with tremendous increase in the last 3 to 4 years. And Juul is one of a startup in the Bay Area. But if you can look at the other ones, the British American Tobacco, Altria, which used to be Philip Morris, Imperial Tobacco, all the regular tobacco companies are now moving into electronic cigarettes and trying to keep their market. So 9 out of 10 cigarette smokers had first tried smoking before the age 18, and 98% have started smoking before age 26. So this, high school, young adult demographic is really key, because that's when they pick it up, and then they are not able to quit. So if you try and limit exposure during this age group, then we can try and curtail overall smoking. So nearly 7 out of 10, nearly 70% reported in 2015 that they wanted to quit, but only 1 out of 10 or less than that were successful in quitting. So it tells you how difficult it is to quit and how important it is to prevent starting this habit. I'm going to go to a case, and then we'll eventually come back to this. So this is a 25-year-old male with fever, cough, and hypoxemia. If it is today, all of you would know what it is, but I don't want to say that word for the next hour. But this is a young man with bilateral pulmonary infiltrates and hypoxemia. This is November of 2019. And the CT scan shows bilateral extensive ground glass changes from top to bottom. This obviously, if some of you may remember, we had electronic cigarette related acute lung injury, and this was obviously a patient with that, and in what we would call as EVALI, or electronic cigarette and vaping product associated lung injury. We'll come to that in a little more detail towards the end of the talk. So what are these electronic cigarettes? These are electronic nicotine delivery systems, also called the ends. They use electric power to heat a liquid, and the liquid usually contains some nicotine as solvent, which is usually propylene glycol or vegetable glycerine, and then there's flavorings. There's lots of different flavorings available. At one count a couple of years ago, somebody counted 7,000 different flavorings available in the market. That's in the US alone. Electronic cigarettes come in various sizes and forms. This one is a typical one we talked about. It's, Juul looks like this. It looks like an USB drive. It's got pods. It's rechargeable. Fancy. Looks good. There are disposable cigarettes for people who want the exact feel of a cigarette. You use one, you throw it off. There are other ones which have got big tanks so that they can hold a lot more liquid. There are something called mods, or modified electronic cigarettes. There are things which are available in the supermarkets and from all these reputed manufacturers, or so-called reputed manufacturers. And then there are things which are available in eBay and Facebook and across the internet, which is all modified. It's very difficult to figure out what actually is in there. But essentially, the electronic cigarette basically has a battery, there's a heating element, and there's a nicotine cartridge which has the liquid. So the battery powers the heating element. The heating element is triggered when the person takes a puff or breath, and the liquid in the nicotine cartridge is heated up and vaporized. And apart from nicotine, there may be glycerine, propylene glycol, flavoring, and then some potentially toxic contaminants and vaporizations, which may be in the product, sometimes some metals as well. The power, a lot of it is dependent on how much power these cigarettes have, and that's why a lot of people modify it and build their own with bigger batteries and bigger resistance and all these things. So it's based on the voltage of the battery and the resistance, inversely proportional to the resistance, which is based on the coil. And the power determines the amount of nicotine delivery, amount of aerosol, and the composition of the aerosol, the active oxygen species, metals and silicates. All of these is determined by the power, and unless it's a very standard product, sometimes it's very difficult to understand how much power or what is the end product of whatever the liquid they are burning. And the aerosol which is generated can have a variety of chemicals, including glycols, aldehydes, metals, volatile organic compounds, glyoxal, methyl glyoxal, and I don't think any of them can be any good to inhale. The juice is essentially, that's how it's called, the liquid, and the liquid contains nicotine, as we said, the propylene glycol or vegetable glycerin, and flavoring. We talked about the flavoring. There's some concern that there are studies which looked at high school students where more than 60 to 70% of them said the reason why they picked up electronic cigarettes is looking at the flavoring. So nicotine on a regular cigarette is what is called as free-base nicotine. It irritates the throat, and there's only a limited amount per cigarette. And because it irritates the throat, there's generally some inherent avulsion to it, till aversion to it, when they start smoking because of the irritation, makes them cough. Whereas in the electronic cigarettes, they use a nicotine salt. It's nicotine with benzoic acid, and that's supposed to be much, much more smooth. It doesn't irritate as much, so they can they can smoke for longer periods without feeling irritated. And the nicotine concentration can be altered, and it can be much, much higher than in a regular cigarette. So a single joule pod, can contains as much nicotine as 20 regular cigarettes. It may take a long time to smoke 20 cigarettes, but can be smoked much more quicker in an electronic cigarette. So this is what I was talking about. This is the free-base nicotine, and the electronic cigarettes have nicotine liquid as a salt, which is usually combined with benzoic acid and salt, which is supposedly smoother. We all know about the chemical constituents of cigarette smoke. We'll probably have several thousands, more than 7,000 chemicals in there. At least 70 of them in a regular cigarette has been known to be carcinogenic. There's some general thought that electronic cigarettes have much less chemicals and therefore less harmful. But the primary ingredient in the electronic cigarettes are nicotine, and nicotine has a variety of influence on health, not just during fetal life, but all the way up to adolescence, including cardiovascular, respiratory, immune, and malignant implications. So when young kids start using nicotine, and that too at a much higher concentration, we're exposing them to all these effects. There are not a lot of data regarding electronic cigarettes. They are coming out, but not in humans. The e-cigarette vapor has shown increase in biofilm formation and cytokine secretion in lab-grown epithelial cells. The implication is that this will increase risk for infection or make the infection worse. There's acute vaporization of the propylene glycol or glycerol, can cause, in humans, can cause tissue hypoxemia, injure the lower airway, and increase airway resistance by decreasing spirometric flow. There are nose-only e-cigarette vapor in mice for a prolonged period of time has shown increased pro-inflammatory and pro-fibrotic proteins in the circulation and increased fibrosis in the internal organs. So there's some developing data to suggest that these can't be good. There are other cardiovascular effects as listed. Nicotine itself can cause arrhythmia, myocardial remodeling, particulate matter and metals in these electronic cigarettes can cause endothelial dysfunction, atherogenesis. The flavorings can cause inflammation, oxidative stress, thrombogenesis, etc. There's also risk for myocardial infarction. There's a retrospective study over 70,000 people showed that daily e-cigarette use and independently increased odds of having an MI for about 1.8. What about any other good effects of electronic cigarettes? Whether can this be used to quit smoking? Again, there are minimal studies and they're not very good. This one is from New England Journal from last year. It was a randomized trial of electronic cigarettes versus nicotine replacement therapy, which is the usual nicotine patches or nicotine gum. The conclusion was the electronic cigarettes were more effective for smoking cessation than nicotine replacement therapy when both were accompanied by behavioral support. This is the final result. This is abstinence rates in 1 year, which was the primary outcome. Electronic cigarettes, that 18% were not smoking regular cigarettes, whereas in nicotine replacement, only 9.9, about 10% were not smoking regular cigarettes, which is almost twice as much, which is not bad. But if you look in detail into the data, if you take 100 smokers, 82 were still smoking, so it means 18 quit. But out of the 18, 14 were still using electronic cigarettes, which means they were still using nicotine in some other fashion, may not be a regular cigarette, and only 4 people were not smoking. So even with the use of electronic cigarettes at the end of the year, it's basically you get less than 5%. There's another article where a pragmatic trial of e-cigarette incentives and drugs for smoking cessation. This was a study of more than 6,000 people. They went to several industries and companies and actually enrolled all the employees there, people who are smokers. What they did was they gave them either usual care, free cessation aids, free electronic cigarettes, and then rewards plus all these things, or redeemable deposit. So last 2 things are this. For rewards, if they are not smoking at 1 month, they gave them $100. At the end of 3 months, if they're not smoking, they got another $200. And at the end of 6 months, if they're not smoking, they got another $300. So if they didn't smoke for 6 months, they got $600. And the redeemable deposit was that they gave them the money in an account, but they cannot take it or withdraw it unless they show that their abstinence. So in the 6,000 people in the intention to treat cohort, you can see still there's very low abstinence. So there's only 1% at 6 months, 2% with money, and 3% with redeemable deposit. So it's not a very good method, even with not just electronic cigarettes, but giving them money on top of it. It's very difficult to make people quit. They have an engaged cohort, which was not in the original plan, which basically the people who replied to their emails, and they call them as an engaged cohort and claimed that they did better, which may be true. But in the intention to treat population, it's poor. This is only after 6 months. So there's always a Cochrane review for all of this. This one was from 2016. As usual, they look at a lot of studies throughout, 99% of them. They find out there's only 2 studies were considered appropriate for analysis, and they concluded electronic cigarettes help smokers to stop smoking in the long term compared to placebo e-cigarettes. And then they said the confidence in the result is low. So we showed that electronic cigarettes is picked up by kids. And kids are the ones who are vulnerable for this, and they'll end up becoming long-term smokers. There's significant amount of nicotine addiction. There's all these other stuff, including flavorings, which can damage. There's data to suggest cardiovascular and pulmonary involvement of this. We show that it's not helping them quit, or at least we don't have enough data to show that. And then we saw that case from late last year with bilateral infiltrates, and we all know about EVALI, right? This electronic cigarette or vaping product use associated lung injury. So since August, the FDA and CDC had been tracking a bunch of cases of young men and women presenting to the emergency room with ARDS type or an acute lung injury without clear source. And by the end of February, there was close to 3,000 people hospitalized. There was at least close to 70 deaths. By the time before the pandemic hit, these numbers have started to wane. But after that, it's been very difficult. There's not good data on tracking. So this is what happened. It started sometime in June, but we started identifying somewhere in August. It peaked around September, and it started to slow down. It happened across the country and all over in all the states. Mainly 2/3 of them were male. Majority of them were young people less than 35 years, and a significant majority of them, more than 80% of them, reported using THC containing products, and where it was linked to this lung injury. Further investigation suggested that vitamin E, which was used in these products, especially THC products, was associated with this, and they were able to identify that based on the BAL analysis. So this was a study looked at 51 cases of EVALI, and 48, more than 90% of them, had vitamin E related product in the bronchial lavage fluid. So apparently vitamin E is being used as an additive in these THC containing products because of their viscosity or thickness. It's supposed to be vitamin D is present, in many foods, but it doesn't cause you any trouble with, obviously, with ingestion, but inhalation causes this inflammatory process. We saw a variety of different kinds of process, include diffuse alveolar damage, diffuse alveolar hemorrhage, eosinophilic pneumonia, lipoid pneumonia, organizing pneumonia, hypersensitive pneumonitis. So it's a variety of different kinds of lung injury was seen, within eval. So at that time, CDC recommended people stop using electronic cigarettes in childhood, which is probably still stands. Right? It said the only way to assure that you are not at risk while the investigation continues is to stop all products. So a couple of things, slides about regulation and electronic cigarettes. In 2016, FDA finalized what's called its deeming regulation, and FDA indicated that no products could come to the market after August 2016 without pre-market review. This is for electronic cigarettes. But then they pushed it back themselves eventually to August 2020, though there was some court order which said they have to look into it by May of this year, but it has not happened. FDA currently has no regulation affecting tobacco retailer licensing, and there are very few marketing restrictions. The 2018 terminology covered all tobacco products and said that there must be addictiveness warning on product packages. So anything which contains nicotine or related to tobacco should have an addictive warning, including electronic cigarettes. In December of last year, the president signed a legislation which increased the federal minimum age to sale of tobacco from 18 to 21 years, which brought the same thing across the country, because there are several states which were doing 18, several states were doing 21. And early this year, before the pandemic started, FDA started some move towards regularizing the electronic cigarette industry, especially after the acute lung injury cases, and they wanted to regulate any flavored or cartridge-based ENDS product, and specifically anything which is targeted toward minors. And they started raiding some companies, and they had some investigation into Juul and all that. But then all of this fell off after March because everybody has been busy with other things. So in conclusion, electronic cigarettes are harmful. They are a gateway to regular cigarettes. They have unintended consequences like the acute lung injury we saw, because there is very, very poor regulation of this. And there's not enough evidence to suggest that they are any good in helping people quitting regular cigarettes. If you see the advertisements, the companies do not advertise themselves as helping with quitting, because if you do that, then it'll come as a drug and it'll be regulated by the FDA. Therefore, they always advertise as a lifestyle difference in terms of, compared to regular cigarette, it's a lifestyle change as opposed to help in quitting. Though they imply it, they don't state it in so many words. Now we're going to go change gears and look at the other new smoking epidemic about hookah and shisha. So this is hookah. Some of you may be aware, some of you may not be aware about hookah. Hookah is a smoking aid which originated in India and Persia more than 1,000 years ago. It's also called nargile, argyle, shisha, or hubble bubble, or goes a lot of different names. The tobacco used in this is usually sweetened with molasses or fruit. It's called masal. And they're typically smoked in groups. This is usually a social activity. So this is what a hookah looks like. So this is a little part in the end, there's a bowl, it's got some water, and there's got a tube which goes all the way up, and there's something called a head. And the head is where you keep the tobacco, um, usually sweetened, and then there's a little foil or something on top, and then there's a charcoal which is lit on top of it. And then the person inhales through the mouthpiece which comes through here. So the tobacco is heated up, and the smoke goes through that, through the water, and then it's inhaled. So sometimes they say a picture is worth 1,000 words. So I don't know how much a real thing is worth. I got a hookah here. If there's nobody here on campus, but if any of you want to show up later, we can have a good time. Hi. Um, so there are some unique features with hookah. It's non-portability because of how big it is, and usually it's in some place you can't walk around. It's intermittent use. People don't do it all day, and they gather in the evening to do this. There are other sensory cues because this happens in a different environment with a group of people. The smoking sessions are usually prolonged, and it's usually a social event. There are a lot of myths related to hookah. It's thought to be less harmful, less addictive. The water in the bowl is thought to filter out the toxins, and so it's not as bad as cigarettes. It's thought that it's less nicotine than conventional cigarettes. And there's some flavors added to the tobacco, and it's thought to impair some health benefit. And as the title says, all of these are myths, and there's no truth to it at all. Right. If it's in the New York Times, it must be good or right. This is from the New York Times, an article from 1997. It says, it quotes somebody about Turkey and smoking. Smoking in Argyle is nothing like smoking a cigarette. 71-year-old pensioner named Ismet Erteb said as he looked up from his pipe. Cigarettes are for nervous people, competitive people, people on the run. When you smoke an Argyle, you have time to think. It teaches you patience and tolerance. It gives you an appreciation of good company. Nargile smokers have a much more balanced approach to life than cigarette smokers. So if only we can get one to everybody in the country today, I think everything will be solved. But it's not true, right? The fact is, the typical session for hookah is about an hour. The number of puffs is at least 200. The volume of smoke inhaled is like 90,000 ml. So if this is a cigarette smoke, right, this is a hookah smoke, right? One hookah session, smokers may inhale equivalent of 100 cigarettes. It's anywhere from half to 1 liter in there. So is this a problem? Is this some esoteric thing, which is in the Middle East, which is not a big deal for us? The question is this a problem for us in the U.S.? So this is a New England Journal paper from 2017, where they looked at nearly 46,000 young adults and school-age kids in 2013 and 14. They looked at ever use of hookah. High school students, about 13%, which is pretty significant number. If you think about it, it's not easy to sneak this in, right? And use within the last 30 days, which is what you call as current use or 30-day use, 18 to 24, which is the college age adult, is about 10 or 11%. So there's a significant percentage of American youth who are, very in tune with hookah. There's lots of other studies which looked at it as well. There's more than 3,000 U.S. adults age 18 to 30 in college and non-college adults. Non-college was less, only around 3%, but in college it was more than twice. It's 7%. Similarly, this is about more than 100,000 respondents of more than 150 U.S. universities. This is almost 10 years ago. Current use was about 8%, and ever use was around 30%. And if you look at it, it's just very, very comparable with regular cigarette use in college students. Virginia, the home of tobacco, Virginia Commonwealth University, looked at it. current use, which is the last 30 days, which is 20% of the students said they were smoking, and ever use was nearly 50%. Something similar in Michigan, which we looked at it because there's a lot of Middle Eastern population in that area. So 12% of them are used within the past year. And University of Pittsburgh, current use within the last 30 days again is about 10%. So these are not small numbers, in college students. Maybe these are regular college students. They don't know the health effects. And if you look at medical students, maybe they may do better. Maybe in Europe they may do better, but it's not true. This is about medical students in Germany and Hungary, more than 2,700 students. Again, about 5% of them were using hookah within the last 30 days. So what about high school and middle school students? In 2016, CDC estimated about 1 million middle and high school students smoked hookah within the past 30 days in 2016. Right. So we know the young kids use, this is a significant increase in college kids as well. Is this a passing fad? They just use it and then they forget about it. But if you look at it, this paper was published in 2018. They looked at more than 5,000 college students, and they looked at them every 6 months in multiple waves. So they looked at it and say, if they have been smoking hookah within the last 30 days, then are they using any other products? So as you can see, if there's a past 30-day hookah use was associated with, other combustible tobacco products. The same thing for electronic cigarettes. Which what it is if they're using hookah, then used hookah within the last 30 days, it's very likely they're using other products as well. So essentially, the hookah may be a passing fad, they may come and go, but then that leads to use of other tobacco products. So it's not just a Middle East issue or somewhere in the Mediterranean issue. There's a significant amount of hookah use in the continental US as well. So what does it do in terms of any of those myths we talked about? Is it real or not? So Eisenberg measured carboxyhemoglobin on people who smoke hookah. They had 31 participants. They smoked hookah for like 45 minutes or smoked one cigarette. As you can see, people who smoked hookah, the level of carboxyhemoglobin in their venous blood, went up to more than 4% as compared to cigarette smoking, which is much, much lower. Same thing with nicotine as well. With regular cigarettes, there's probably a quick increase, but with hookah, there's a sustained increase in nicotine, and they were overall exposed more than 1.7 times more exposure to nicotine than a regular cigarette. There are other machine-generated testing which has been done, which showed, same thing, maybe around between 1 and 2 times the amount of exposure to nicotine. Same thing with carbon monoxide, it's nearly 7 times, and a significant increase in tar is probably maybe related to the charcoal they use with exposure to hookah smoke. The interesting thing is about all these nicotine, carbon monoxide, particulate matter, VOC and metals, all that, there's a significant amount of cardiovascular impacts. The data is not very good, but there was a statement from American Heart Association last year in 2019 where they felt water pipe or hookah smoking directly have impact on myocardial infarction and stroke, and therefore should be avoided. For the cardiovascular impacts, there are other people who have looked at it, individual problems. They looked at like 50 hookah smokers. They measured several parameters before and after a session of smoking. So systolic and diastolic blood pressure went up, pulse wave velocity, which measures the stiffness, went up. Similarly, augmentation index also went up. And not surprisingly, heart rate, nicotine concentration, and carbon monoxide concentration, all of these went up in patients who smoke hookah. What about lung function? Rad et al. Published about 10 years ago a meta-analysis of 6 studies looking at several hundred hookah smoking patients. versus controls. It showed spirometric values. There's airflow limitation, meaning the FEV1 or forced expiratory volume 1 was lower in people who smoke hookah, and the FEV1 FVC ratio, which denotes limitation of airflow, also was lower. There are several other impacts secondary to hookah smoking. There's increased risk of lung cancer, increased other respiratory illness, low birth weight, periodontal disease have been described. There's increased secondhand smoke exposure because there's a lot of smoke and it happens in groups, in closed spaces. And there's increased risk of other infectious disease, including TB, because they can share the same mouthpiece across. So the other association concerning can be a gateway to cigarette, and we saw that, and they start smoking hookah and then eventually get to cigarettes. Sometimes people try to get out of cigarettes by trying hookah with the impression that this is much less deleterious than regular tobacco. But there's also, which is not true. And again, there's strong association with use of alcohol, along with hookah smoking sessions, other tobacco products, and marijuana. We all know tobacco addiction is an epidemic. We talked about this in the beginning. There's at least 1.3 billion smokers in the world. It's still going up in places like China and India. More than 5 million die from tobacco-related illness every year. 10% of them, somewhere on that number, die from second-hand smoke, which is a big deal. And obviously there's more deaths from HIV, TB, and malaria combined from tobacco. So quick last couple of slides. So I know you all read Applied Optics. That's my favorite journal as well. There was this piece in 1972 in Applied Optics about the temperature of hell. They felt it must be less than 444.6 degrees Celsius, because that's the boiling point of, that's the temperature at which sulfur goes from liquid to gas. And since hell is supposed to have a boiling sulfur lake, so they felt that must be the temperature of hell. And from the Encyclo Britannica of our generation, YouTube, we know that the temperature of hookah is 447.3 degrees Celsius. So if there's one thing I want to remember from this talk, it's this, which is hookah is hotter than hell. I'm going to stop there. And if any of you are on campus, feel free to stop by. We can share a hookah. Thank you.
Thanks, Srihari. I think you sufficiently made us not want to share a hookah with
you. Thanks. I can't see you because the monitor in here is not working. So I don't know if anybody's there or not. But I'm glad I conveyed my stuff to at least one person.
No, you have 83 people here, so a very good crowd. And everybody, please feel free to put a message in chat, because I can curate that and actually ask a few questions. But I had a couple for you quickly. The first is the use, like you showed that a quarter or so of teens, etc., have used hookahs, but is it becoming more popular, or was there like a peak and it's becoming less popular? Like over years, in that population, is it increasing?
So I think the definite increase was somewhere in the middle of the decade, before electronic cigarettes became even more popular. I think with increase in electronic cigarettes, it has come down, but there are areas like college dorms where there's still increase, slow increase, but still somewhere around anywhere between 3 to 10% in universities. It's lagging. In places like high school, where it's very difficult to sneak something in, I think the popularity of the electronic cigarettes had made this less attractive to kids.
That's interesting. So I know at the beginning you said you hoped to make it through an hour without this this noise, but I have to ask, there was sort of recent data looking at the association with vaping and COVID-19 risks. And so I was curious your thoughts on that, and if you thought it was related to the biology and lung injury, or if it's just people congregating together to smoke together may be at increased risk.
Yeah, I think, it is probably more related to social distancing or lack of it rather than anything. I've not seen anything where other than just pure association between this. And there's even actually one paper on, or somebody wrote an opinion on hookah and COVID-19, said that because of all the proximity and people are together and smoking, there's going to be an increased risk. But I don't know of any scientific data. These were all probably only case reports where they said there's associations.
Thanks. In the chat, there's a number of questions. The first, the addiction potential of e-cigarettes is high. Do you think that interventions tested for regular cigarettes will work as well for e-cigarettes?
I mean, it's tough because electronic cigarettes, it's the nicotine addiction, right? So, and then there's a significant amount of nicotine in there. So I'm not sure the intervention or the medications which we have used for regular cigarettes have not been very successful at all. It's very little. There must be a lot of motivation of the patient, and you have to be really, really driven to quit. If it's not, so I don't know of anybody who had used any of this or published any data to try, Wellbutrin or Chantix or any of those as treatment for e-cigarettes. But e-cigarettes have, at least at this time, been used as though it is a smoking aid by itself. One of the things which has been suggested is to walk down the nicotine concentration in the electronic cigarettes and slowly help, by decreasing that, and so that they'll be able to get off the nicotine. But I don't think there's been any data which suggests that any of the other things which we use for regular cigarettes helps with electronic cigarettes.
Makes sense. Question asked, is there significant overlap between hookah use and alcohol use, thinking especially about college students in the U.S.?
Yes. I don't know the actual data, but there is it's a strong association with hookah use, with regular tobacco use, with marijuana use, and alcohol use.
Practical question. For those of us taking histories from patients, is there a way to translate e-cigarette or hookah use into like packs per day or something in order to guide screening and risk stratification?
Answer is no, unless we know the amount of concentration of the nicotine in the liquid. It's very difficult to even have some kind of scientific understanding.
So then, I think tagging along to that, for those who abuse hookah, is it fair to say it's worse and will kill a patient even faster if used socially, just like once a day?
I'm going to say yes, but it depends. I think the hookah use probably is going to be associated. If there's a regular use, then there's definitely going to be increased impact because the amount of smoke is much, much higher.
When I mentioned you had a lot of participants, I failed to mention that some of these are large conference rooms. So coming from EUH, we saw a lot of headlines in terms of regulation for e-cigs. Do you think this will occur at any time soon?
There was a lot of push. It happened in 2016, and then they dropped the ball, and then they were supposed to be sometime later this year. In the beginning of the year, there was a lot of push after the acute lung injury cases. Unfortunately, because of the pandemic, all this got lost. I'm hoping that it'll get done, and like I said, if this is something actually, electronic cigarettes is just like any other technology, is really good. It can be used for tobacco cessation. You may be able to control the amount of nicotine in there, and just like you would give 21 nanogram patch and 14 or 7 patch, and all the different size patches. You can prescribe different levels of nicotine to smoke to bring it down, at least theoretically. But the industry is not ready to classify it as a smoking cessation aid, which will become a drug. So it's still a social industry. Uh,
I didn't about that,
I
yeah.
don't know whether the regulation will come or not. I'm hoping it will, but we have to wait and see.
Another question, has the effect of secondary smoke from hookah use been evaluated in the same way that it has from regular cigarettes, and if so, how does it compare?
No, I don't know of any. There are things where they look at urinary concentration of all these chemicals in people who work there, but it's not as much as it's in regular cigarettes, secondary smoke. Uh, Most of it is just opinion based on the fact all these places have a lot of smoke, and that's what it is.
Got it. All right. Any other questions from the audience? Somebody can feel free to unmute if you wish. Well, thank you, Srihari, so much.
We've got one, Dr. Armstrong.
Wait.
We had a question regarding the water in the hookah, and the myth that the water is used to filter out toxins that is coming from the tobacco. And if that's not the case, do we know what the purpose of the water is?
I don't know. It's been around for 1,000 years, so I gotta. So I think it probably mellows down the smoke, and it's probably ends up. So that's why you can inhale a lot more. So it's maybe some humidified. I don't know how all this started, 1,000 years ago, and sometimes people put in alcohol. Somebody asked an alcohol question. Sometimes the college students put alcohol in there instead of water, or mixes some extra alcohol in there, and so to increase, whatever you get out of it. So I don't know the answer to the alcohol.
The chat
Somebody
also
said it
mentioned
cools off
that-
the temperature of the smoke. Yeah,
Yeah,
and for flavoring. Yeah.
for flavoring.
Yeah, Shireen, this is the one I borrowed from you. I'm going to tell everybody. There's your hookah.
All right. Well, thank you so much. I didn't get a chance to introduce you because you were in person and I was not, but I wanted to mention that Srihari was very gracious to do this because he was the first person who was canceled last year when the pandemic hit. And so had